It's been 5 years since the publication of the pivotal paradigm heart failure trial, which demonstrated that sacubitril valsartan use in patients with HFrEF reduced the composite of all-cause mortality and heart failure hospitalizations. However, the real-world uptake of the medication has not been the expected one. Early trials in small selected populations indicated that this could partially be explained by the difference in criteria between the trial, the ESC Guidelines, and the drug label. This was the purpose of our analysis, to assess the eligibility of patients in a real-world large registry regarding the fulfillment of criteria based on paradigm heart failure trial, the drug label, as well as the ESC heart failure guidelines, as well as to compare outcomes between these real-world registry patients and patients enrolled in the paradigm heart failure trial. Data was derived from the ESC HFA EORP heart failure long-term registry, which is a multi-site, prospective, large-scale, multi-center, multinational registry of the ESC. This analysis was performed on 5,400 patients approximately, who were enrolled in the registry over a 2.5-year period between March 2011 and November 2013, across 28 countries within Europe and within affiliated to the ESC countries. Data analysis was handled and provided by the relevant statistical department of the EORP program. In HFrEF patients in the registry, baseline demographic and clinical criteria were similar, but heart failure treatment was different compared to patients enrolled in the paradigm heart failure trial. In regards to eligibility, 84% of these registry patients were NIHA classes 2 and 4, and thus eligible for sacubitril valsartan based on the drug label. However, this eligibility fell to 12% when all eligibility criteria based on the paradigm heart failure and the ESC heart failure guidelines were examined. When the criterion of receipt of an ACE inhibitor or ARB at a daily dose equivalent to at least 20 milligrams of enalapril, which was the most difficult criterion to be met, was cut to half, to 10 milligrams daily, then eligibility rose to 28%. Concerning outcomes, the outcomes among patients in the registry were different compared to patients enrolled in the enalapril arm of paradigm heart failure. However, these outcomes differed significantly according to the fulfillment of different eligibility criteria or not. We hypothesized that the trial criteria and the guidelines could explain implementation of drug in real world, and therefore the numbers in our analysis may indeed explain the proportion of uptake of the drug, but heart failure quality of care in general. In this direction, we believe that further research is warranted in contemporary data of registries, which provides insight into the uptake of the medication in contemporary era, with a particular emphasis on eligibility criteria, if these are available, as well as adverse events and drug discontinuation.